Hey, welcome back. Matthew McKenzie here again, doing a little short lecture on this one, to be honest. If you don't know me, I'm a care activist. That means raise awareness on unpaid carers, especially those who are caring for someone with mental illness or caring for someone with cancer. If you go for some of my videos and you like them, do subscribe, make a comment. Always happy to engage that way. I also have a website, caremind.com or caremindblog.com. Check that out. I'll put the website description or the address in the description of the video. But let's get on. This video, I thought to aim it at those caring for someone using the mental health service, perhaps using the services of an NHS mental health trust. But the thing is, it's not always easy to tell who is doing what when it comes to supporting someone with mental ill health. And I'm actually referring to who's in the team. I'm going to go through a list of 23 key staff linked to a community mental health team because, let's face it, depending on the mental illness, you're more likely going to have your loved one out in the community. Not always, obviously, if they relapse and end up back on the inpatient ward. The reason I'm actually decided to list out 23 key staff that carers should try and know, and not all of them will be, will be appropriate. Some might be only for specific ill health. Some of the key staff actually might have their roles ingrained into another key staff member. So you might not have a particular person that does that role. That means those roles are shared between the staff. But at the end of the day, it's so important that you as a carer know who does what. And as a reminder, are some members of key staff that are missing. I think if I drop a true list, it would probably, be around about 30, 35, because what I'm getting at here is that each different mental health service, or each mental health service has different key staff. It really depends on the funding, I suppose, and what patients or carers feel that's so important as key staff. So anyway, these are the most general you might find in regards to mental health service. So let's start. The first thing I think is going to be most important if your loved one gains access to secondary service, and I'm talking about NHS mental health trusts. Very first one would be psychiatrists, to be honest. This is perhaps one of the most common type of key staff you would come across, and it's so important again as a carer. One of the number one, not always though, but usually someone you want to speak to when it comes to diagnosing and treating mental health disorders. And they're the ones that would prescribe medication and provide medical assessments or care plans. And this obviously would need to involve yourself, obviously depending on your loved one's permission, but still psychiatrists are almost at the center in regards to the support the person is getting, and involving you in that care, and at least for them to give you education in regards to supporting someone with mental ill health. So psychiatrists are usually one of the key members of a community mental health team, whether they're on the inpatient ward or perhaps engaging with staff out in the community. Next one on the list is psychologists. And what do psychologists do? Obviously, it's fairly similar. I don't think they do much with their medication, but they're the mental health professionals who assess and also treat mental health issues through psychological therapy and through testing of that of how their mental ill health is working towards that therapy. They often provide therapy but do not prescribe medication. So that's the big difference between psychologists and psychiatrists. but they're still very important in regards to how your loved one is coping out in the community. Um, and with therapy, and I think when it comes to psychological therapy, it's absolutely vital to include this when it comes to those who are working on recovery regarding their mental health. So I'm sure as a carer, you have a lot to say in regards to psychologists. We have next on this mental health nurses. They can usually when you think of mental health nurses, you think they'll exist on the inpatient ward. But that's not always true. They're out in the community as well. What do they do? Registered nurses with specialized training in mental health. Obviously, you can get other different types of nurses, but we're talking about mental health here. They provide care, support, medication management, and often work directly with patients and families. So usually you may sort of see them when you visit the wards, but they can be out in the community. One thing to take note is that I will look into the roles of each of these key staff at a later date. They do a huge amount. They're very well trained. Obviously, as humans go, there are always clash of differences and issues and whatnot, and for staff to take on care awareness training. But as on this one, I'm just listing out key staff you should get to know or would more likely be in that team. Some may come and remain regarding your mental health treatment, and others might only be there for, just a little bit of time, not going to be there for, for a long length of time. So clinical social workers, they are more likely to be there for a long length of time, to be honest, assigned obviously to the person you're looking after. But they can also work with yourself as a carer. So what do they do? Very basically social workers who provide therapy, support an individual and their families. They also assist in accessing community resources. Now that's absolutely critical because once your loved one's out in the community, the social worker will be the bridge, they'll be the key if your loved one is willing to take on community resources and be referred to specific resources that'll help them with day-to-day activities and also navigating social services as well. So again, at a later date, I'll look more in depth to what a clinical social worker actually does. Let's continue. So next on the list is counselors and therapists, and what do they do? Well, trained professionals provide individual or group therapy, helping patients address the emotional side and psychological challenges. So it's less on medication and more of the psychotherapy. Again, really slightly similar to psychologists, to be honest, but they will delve in a bit more to how the patient is feeling in regards to the effects of mental ill health. It might be dealing with depression, it might be how they're coping with psychosis, someone that they can talk to and delve out a plan on coping strategies. Again, this is something will present on fully at a later date because they do a lot more than what I'm saying. But I just want to point out key staff. And as a reminder, there's certain key staff that won't be there. Their roles might be ingrained in another staff that is actually on site at community mental health team or on an inpatient ward in the hospital. Occupational therapists, these are more rare, I would say, but they're very important in what they do. Therapists who, again, help individuals develop, recover, or maintain daily living and work skills through therapeutic activities. We also got psychiatric technicians, staff who assist with day-to-day care of patients in psychiatric facilities, supporting them with activities of daily living and also monitoring their behavior. This one won't be, this is specific to a particular ill health, like addiction. So you're not really going to find it generally for all mental health patients like you would, perhaps a counselor or social worker. So this is more addictions. And they're specialists who work with individuals struggling with addiction or substance use disorder, but also providing therapy and support for recovery. We also got rehabilitation specialists. And what do? The professionals who help the individual with mental illness to develop skills for independent living and integration in the community. So I don't think I think they're more rare, and you might get them in regards to psychologists or therapists, to be honest. Or their roles might be there, but for specific other key staff. We also got case managers, and I think those are rare as well, to be honest. The coordinators who assist patients and the families in navigating mental health services, ensuring that necessary resources and support are accessed. So case managers, I think their roles are more sort of focused with the social worker or the care coordinator, to be honest. You don't often get case managers, and if you do, then that resource is, well, it's well funded, to be honest. I don't doubt that some are there. We also got the crisis intervention specialists. And what do? They're trained professionals who respond to mental health crisis, providing immediate support and stabilization for individuals in distress. This one I've seen, a fair number of times. Family therapists. I actually had a few sessions myself in the past. Therapists who specialize in working with families to improve communication, resolve conflicts, and support individuals with mental ill health. Again, with family therapists, some of the roles they do, it might be passed on. Like some of the specific roles could be learnt from a social worker or a care support officer. Who else? We have psychoeducators. I think they're definitely very rare, unless I suppose your mental health trust is like a recovery college, and you're more likely to get them there. So professionals who provide education and training, and that's why I mentioned recovery college, because they're more likely to be situated there. Not always. You might have them on site in the community, and they will help with training about mental health conditions to the patients and their families, enhancing understanding and coping strategies. So if your loved one is using mental health services in the NHS, do inquire about recovery colleges. They're free to attend, and you're more likely going to get them there. Behavioral health technicians. So what do? They support staff who assist with implementing treatment plans and provide direct care to individuals in mental health settings. So again, I think they're sort of often situated to more chronic mental ill health. This one's quite important. And the reason I say, it's really important really is because of the side effects of some of the medications can have an impact on someone's physical health. And there are times, again, the effects of the mental health can cause situations where the person with ill health is not really eating or choosing the right types of foods. Added medication can actually make someone really hungry, to be honest. So it's really critical you can get access to a dietitian. Sometimes the mental health services will refer actually to dietitians and nutritionists. So obviously, what do? They specialize, the specialists who focus on nutritional needs of individuals' mental health issues, emphasizing the connection between diet and mental well-being. Also got art and music therapists. I think they definitely would visit an inpatient ward. Well, I've visited quite a few inpatient wards in the past, and I usually see like music instruments, in a room, and the only way that usually happens is an art therapist or a music therapist will come in, and I think this is really important. Their role, it's obvious. They're creative therapists who use art and music as a therapeutic tool to help individuals express emotions and process experiences. So it's not always about medication. There are other means and tested methods. It's quite tricky though. You can't force people to take art and music therapists, art and music therapy. And there are the types of therapies where you got dancing, which has a double benefit of exercise. I think that's very critical. So it's not just art and music therapists, they're all types of therapy. I myself use poetry as a means of therapy and expressing creativity when it comes to carers. So what else have we got here? We've got psychiatric rehab specialists, professionals who focus on helping individuals with mental illness achieve personal goals and improve their quality of life through rehabilitation strategies. This one is very critical for a number of reasons. I won't go into it too heavily. And in fact, if I wanted to explain more roles, obviously psychiatrists and social worker and care coordinator and the care support officer, I'd probably pick out, and perhaps the pharmacists. But out of all of them, peer support specialists are absolutely crucial. Not to say the others aren't, but peer support specialists, I think, are crucial when it comes to empowering and advocate and helping to advocate and providing a network, as I wouldn't say network, but a link in the community, not only for the mental patient, but even for the carer. Not always. There'd be specific types. Peer support specialists are actually individuals with lived experiences, and this is what the key method. They would use their skills of that lived experience. So you could say that they have been from the mental health system, so they know the language. They can relate more to the person that you're caring for, and can help support them using the skills of peer support. So they will provide support and guidance to others facing similar challenges, fostering hope and a form of recovery. So I think this one's crucial. If you can find a peer support lead, it doesn't have to be usually they're visiting patient wards. You might get them there, or if they're out in the community. A good example, I suppose, is you have like mind branches or rethink mental illness branches. You probably get your peer support specialists situated there. And you may have also some at care centres. You might be network partners for carers trusts. You might get care peer support, especially. In fact, I could consider myself one in regards to peer support, but obviously for carers. Let's continue. What do we have? Community outreach workers. I think they're getting a bit rare, but one could sort of say there can be also social prescribers in some sense. But what do they do? They're staff who connect individuals and families with community resources and support services, often focusing on prevention and education. So yeah, you do still have them, but I would say they're more now becoming social prescribers, or there's another term for them, doing the same thing, but they're not sort of just limited to the mental health setting. You may get them more at the doctor's surgery. We've also got administrative. Well, this is going to be the most common you would find. And even if you're a carer, you're more likely to be talking to them a lot. So that even though the administrative staff, to be doing a whole lot more than what you think. So the personnel handle scheduling, intake, administrative tasks in mental health settings, ensuring smooth operations and access to services. Um, People you speak to on the phone would more likely be the admin, staff, reception, that type of thing. So they're quite vital in order to get access to other staff even. Let's continue. independent mental health advocates. So again, very important when it comes to mental health law. Why is that? Well, IMHAs, short for Independent Mental Health Advocate, provide free, independent, and confidential support. IMHAs actually help people understand their rights under the Mental Health Act. IMHAs can support people in meetings, helping them ask questions and ensuring their points are included. But I do think IMHAs can be quite rare now, but they're vitally important when it comes to mental health law. I don't think they're easy to get hold of, and that's why you probably would get advocates outside that, they may be referred to advocates actually outside the mental health system. Pharmacists, again, very important if you have a psychiatrist prescribing medication. As if that's the case, then as a carer, you might want to definitely get to know the pharmacist, because obviously what they do, they identify the best medication for the patient. So they'll be in communication with the psychiatrists. They review the effectiveness and tolerability of that medication. So it's important, if you notice any side effects, you speak to that pharmacist, and also advise on how to best use the medication, including storage and administration of that medication, whether it's oral or through injection, or it's a depot. Now, this is perhaps the most important of them all. If you're a carer, they actually, even though it says care support officers, there are subsets of a care support officer, and they don't often always have to exist within the community mental health team. You might actually get a mental health carer support officer existing in a carer center, who would be the bridge between the mental health services and the carer center and yourself. You also have carer leads, carer champions, carer advocates, but most of the time, you're more likely to get a care support officer. They can be rare, to be honest. It's a very skilled profession, especially when it comes to carers. So they engage with carers, record the details of the carer. They sometimes act, as I said, the link between the mental health staff and the person caring for those who have mental health. So educate and train carers, but they also educate and train other staff about the carer's role. They will listen to carers and also learn from the concerns or issues from the carers and relay that back. They also remind carers of their own well-being, and it's not unknown for care support officers to do care assessments, but take note, there are different types of care support officers. Some cover several boroughs, some might cover just the one patch. So they're really different types. Some are actually known as carer network leads. So they're whole different types of care support officers, but they'll be your main focus in order to get support if you're lucky that your mental health trust actually has one. So the conclusion really, and I did try and keep this short, probably failed keeping this lecture short, is that it's important that as a carer, you get to know whom to contact for specific needs. And I'm sorry to say this, I've missed off still quite a bit of mental health staff, a huge amount. I might have to come back to this lecture at another point and include another 15. I could want to be a solicitor, to be honest. They're very important. So knowing who to contact for specific needs can lead to more effective communication and faster resolution of concerns. Take note of not really added effective ways to communicate when it comes to those different roles I've mentioned here. There's specific means of communication. You're not going to speak to an administrator as you would speak to a psychiatrist. And you're not going to be after the same thing if you're speaking to a pharmacist compared to a social worker or a psychologist. So they've got different ways depending on what you would want to speak to them about when you're as a carer. Some are easily accessible, some are very difficult. And again, I've forgotten to mention like ward managers. They're going to be, again, important when things get a bit difficult. Advocate, in a way when it comes to staff, carers can advocate more effectively For the individual, they support by understanding the team structure and process. So there is actually a structure. Again, I've not included that. I should have. Who actually makes decisions for other staff, who has the more influence when it comes to how you engage with that list of staff. Enhancing collaboration. So as a carer, it's important to build relationships with those team members who can facilitate a more coordinated approach to care and treatment. So obviously the main relationship you want to build with is the care support officer, because they will help relay and they know the language of the mental health team, and access resources. So definitely identifying the right professionals can help carers access valuable resources and educational materials tailored to their situations. Again, it's not always what the social worker or care coordinator or the care support officers provide. I always say, take a trip to your recovery colleges. In fact, it's known that you can actually use different mental health trusts, recovery colleges, especially if they have stuff online. I will perhaps do a session on recovery college. I think it's really important, a useful resource for carers and patients and even staff to learn, what is out there. In fact, what I'm actually lecturing now would be included in a recovery college course. So last bit, again, what I say to carers, familiarize themselves with the mental health team. Carers can enhance their support for their loved one and navigate the mental health system more effectively. So the key word there is get to know the team, because the more you know who does what and why and when, the more you can navigate the mental health system. And if you can navigate it well, then you can support your loved one well. The more people in that team, the better the outcome, not only for the patient, but for yourself. So if you like this video, this lecture, again, give me a like, subscribe for more to come. I'll try and do one per day, maybe more if I get time. But I'd like to say thanks for watching, and I'll see you again soon.